Hi, my name is Alyssa and I'm with Knob Noster Physical Therapy. I got my workout gear on because we're working out. Today I will be showing you our third and final video on our Return to Sport testing series. Today we will be focusing on the triple hop test. This is one of our more challenging tests that we do, but it is very important to determine whether a patient is able to produce force and land appropriately on one side as compared to the other. So this is very important that we're seeing a nice symmetry equally, as this tends to show better outcomes as far as reduced injury in the future, as well as sports performance and being able to return to that same level as they were competing at before. So for this test, how we will do it is we are going to start on one leg, hop 3 times on that leg, and land on that same leg without ever touching down on the other side. Again, similar to the broad jump video, we will be doing 3 repetitions on each side. This offers a little bit more of a learning curve, so lets people figure out the test on the first 1 or 2, and then getting a good solid reading on that second or third one. Important things to remember while we're doing this is that the patient must land on that one leg and maintain it. So if they fall down or they bounce out of it, that is not a valid test, and that would actually be a no score. So that's another reason why we do the 3 times testing, so that we actually get a valid reading and at least one of them. We also will do this side to side. I like to do it on the uninvolved side first, just so someone can figure out what exactly the test is testing, how to land, learning what kind of force production they can produce and still stick the landing before they go onto that other side. As a lot of times patients don't always trust that other side as much, which we work to decrease that feeling and improve their confidence in that limb. But it gives them a little bit of an opportunity to figure out the test before they go onto that other side, that affected side. So what we do, we are going to start on one leg. We'll hop 3 times and land. So I'll go ahead and demonstrate that for you. And so there, our goal is to jump the farthest that we can. I would measure this with a tape measure on the floor, measuring where their heel lands on that final jump. Again, we would do that 3 times, making sure that we complete it then again on that involved side. As it is a little bit more of a challenge for patients, a lot more balance, a lot more force and landing production on one side versus the other, this does tend to be a later test that we utilize. So we will usually try the shuttle drill and the broad jump before we introduce this one, and we will have worked a lot on jumping, landing, force production on both sides before we would tackle this test. As always, if you need anything, please reach out to the clinic or check us out at knobpt.com. Thank you.